Governor Nixon met with health providers, community leaders, and members of the Saline County Commission in Marshall to discuss the potential impact of House Bill 253 on area facilities that serve Missourians with severe behavioral and developmental disabilities. A recent report requested by the Missouri Mental Health Commission found that an override of the governor's veto of House Bill 253 could result in a $164 million cut to services provided by the Department of Mental Health.
With a price tag of more than $800 million annually, House Bill 253 would undermine our state's ability to support vital public services now and in the future. Just to put that total number in context, that's the equivalent of eliminating all state support for our colleges and universities, are closing all our prisons, are shutting down the entire Department of Mental Health.
Habilitation centers provide residential and other support services to Missourians with severe behavioral and developmental disabilities. A veto of House Bill 253 would result in the closure of 5 state-operated developmental disability habilitation centers in Marshall, Higginsville, Sikeston, Poplar Bluff, and St. Charles.
I am very passionate about children, and especially when it comes to education, and I think that this bill would take vital money from education and also mental health.
They're not just numbers. It's not just so much money. It's not like you're going to a sale barn with livestock to where it's so much a head. You know, that's people have to get past that. They can't just be in that form of mind, in that state of mind. They have to look, like I said, at the human factor. You have to know that you're getting ready to turn someone's life upside down.
You're looking at $700,000, $800,000 in cuts to Marshall Public Schools, and right now, Marshall Public Schools is just basically recovering from the economic crisis that has just occurred, and from the recession. But so we haven't made huge advances towards replacing those programs that we already had to cut because of the recession. But those types of cuts that we would have to be looking at would be personnel. And when you talk about personnel, you're talking about programs and you're talking about larger class sizes.
These centers today help hundreds of individuals in this region with severe developmental disabilities and behavioral disabilities live fuller, more productive lives. The services range from the very simple, like cooking a nutritious meal or doing laundry, to the very complex, like developing new skills to land a job. Closing these campuses would be devastating, not only to those Missourians and their families, but also to the economic health of this region, putting hundreds of jobs at risk. Quite simply, that's wrong.
To learn more about the effects an override on the veto of House Bill 253 would have on mental health, visit governor.mo.gov.